Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to make a better system for all of us. We're going to be talking about changes in federal agencies and a number of other topics, but before we do, down below in the YouTube description box is a link to the Healthcare Advocacy newsletter. You'll find all of the medical references, all the news articles, medical journal publications, and a host of advocacy resources are all available there, together with some resources that might be valuable if you need reproductive care or you're fighting a claims denial from an insurance company. Anyway, let's get started. Oh, I should point out, you can go there and subscribe for free and have it delivered into your mailbox, your email box daily, mostly daily. Let's talk about the Center for Disease Control and Prevention. They are now operating without an acting director. Multiple health officials have affirmed this. They're leaving the agency, this leaves the agency responsible for defending the U.S. against emerging pandemics and responding to health emergencies without a clear chain of command. A leadership vacuum at the top of the CDC is unprecedented. Under previous administrations, including Trump's, officials always made sure to either immediately appoint their pick for the position or decide during the transition period who would assume the top post in an acting capacity. Other federal agencies are also operating without named heads, including the FDA and the National Institute of Health. The confusion over who is leading the agency comes as health departments around the country are responding to multiple outbreaks, including an unprecedented outbreak of bird flu, this winter's seasonal surge of respiratory viruses like influenza, and a record wave of the notorious stomach bug norovirus. So regular trusted advice about these and COVID are not now available to support public health officials or the public, because this administration is much like Melania's jacket. I don't care. Reproductive health in Michigan, let's talk about that. Michigan Governor Gretchen Whitmer signed 2 bills into law this week that will allow pharmacists in the state to prescribe hormonal birth control. That was House Bill 5436. You just go to the drugstore and the pharmacist writes the prescription. She also signed a second bill, House Bill 5435, that requires insurance companies to pick up the cost of the pharmacist prescribed hormonal contraception in the state of Michigan. Good going. The next story has to do with Mississippi. It sounds like a lawmaker needs mental health services, but he's really showing just how extreme MAGA right-wing legislators are. A state senator in Mississippi has demonstrated just how extreme anti-reproductive political posturing is by filing a bill called Contraception Begins at Erection Act. As written by Senator Bradford Blackman, the bill would make it unlawful for a person to discharge genetic material without the intent to fertilize an embryo. Of course, there are fines because you have to have consequences. The third strike fine, it results in $10,000, and a $10,000 fine for this felony. In a statement to WLBT News, Blackman wrote, "All across the country, especially in Mississippi, the vast majority of bills relating to contraception and or abortion focus on the woman's role when men are 50% of the equation." There you go. I want to talk about why we need universal health care. Let's start 2025 with that. These are some thoughts from the Commonwealth Fund from their 2025 report. I want to point out, if you're not familiar with them, there's a link to their site in the newsletter. They are worth going to see. They have been in the business of lobbying for better health care for all of us for more than 100 years. Let's first talk about delays and denials. Healthcare in this country is increasingly prioritizing revenue and profit over patients, and people are just unhappy about it. They don't like the current state of affairs. Remember that business as usual practices for health insurers so often result in delayed or denied care with severe financial results for the patient, and sometimes it's a life and death issue. Now, private equity is destroying care. This is another big problem they highlight. A few weeks ago, private equity squeezed every last dollar out of Steward Healthcare. They actually forced them into bankruptcy. It was the nation's largest for-profit hospital system, and they did it by sacrificing quality and safety and patient care in exchange for money. The way they did it is a little complicated, but it's not uncommon in the private equity investment in healthcare world. Now, their callous behavior destabilized the care of lots of patients across multiple states. We also have hard to get and hard to afford care. It is a real problem. Many people who have health insurance can't get the care they need because there are costs involved for them, or they simply don't have access to the providers they need in their communities. Now, the Commonwealth Fund recently found, this was a shocker to me, a quarter of working age adults, that's people 19 to 64, had insurance but were underinsured. That is, they're enrolled in health plans with super high out-of-pocket costs or very high deductibles that make it really difficult to afford care. And what happens with these people and others are they skip needed care. They just say, I'm not going to go to the doctor. I can't afford the copay. I don't want to meet the deductible of whatever, $15,000. They avoid going to doctors. They avoid going to a specialist. They don't get prescribed medicines filled, the prescriptions filled. These are heartbreaking choices between needed treatments and necessities like food or rent. At the end of this chain reaction, just poor health outcomes that are completely preventable. Anyway, I have a link to that report in the newsletter, and it's worth reading. We also want to talk about high costs and poor outcomes. The Commonwealth Fund highlighted this because this has been going on for quite a long time, and the U.S. is not taking steps to fix it. Here in the United States, we spend the most, far more than any other developed country, for healthcare, but somehow we have the least to show for it. We have lower life expectancy, higher infant mortality, higher maternal mortality, more chronic disease and health disparities than our counterpart nations across the globe. In addition, we have wide disparities across the states in the U.S. in terms of health outcomes, in access to care, in quality, and in equity. The Commonwealth Fund wrote a report it's about a month ago called Mirror, Mirror 2024. I have a link to it. It's a heartbreaker if you go read it, but it's worth reading. It compares the performance of the healthcare systems of 10 countries, they're peer industrialized nations, and the United States. And what do they find? The United States is again in a class by itself, and that class is at the very bottom in almost every measure of quality. I want to also point out that according to the National Institute of Health, 62% of Americans want universal health care, and I have a link to that report. Our legislators, both state and federal, are not listening because they're not taking action on this. Look, let's let our state and federal legislators know. They need to take universal health care seriously. Now, I have a link in the YouTube description box down in the resource section towards the bottom, or my favorite, on your cell phone, all you have to do is send a text message to 50409. The message is SIGN, S-I-G-N, space, PJAFTD. PJA, F as in Frank, TD, to 50409. And here's the message you're going to send. It goes to the president, your senators, your members of Congress, governor, and state legislators. It says, I am your constituent, and we all deserve a healthcare system that we can trust and afford. And I want you to know that we in the U.S. pay almost double what people in other industrialized countries pay for healthcare. They have lower infant mortality, lower maternal mortality, less chronic disease, and significantly longer lives. They don't go bankrupt paying for care either. Universal health care can take many forms. It can be executed at the state or the federal level. It can be a public insurance trust or mutual trusts run by nonprofits. It can be for-profit insurance companies selling a basic policy for no profit, and then offering optional insurance policies that have additional coverage. Or it can be a system that's completely owned by the government. There are 35 industrialized nations with universal health care. They have all done it differently, but they all did it. And their citizens are healthier, live longer, and pay way less than we do. I want you to implement universal health care. 62% of Americans want it. That should mean something to you. Please get on it. It really is a matter of life and death. And P.S., here is a link to the National Institute of Health Studies so you know that's for real. Okay, that's what I've got for you today. Send me comments, send me suggestions for reports that you'd like. You can reach me here at YouTube or at healthcareadvocacy1@gmail.com. Have a good evening.